Hi, my name is Andie Burjek. I'm an associate editor at Workforce Magazine, and right now I have Gary Kushner. He is the CEO and president of Kushner Company, and he is a healthcare expert. So, nice to meet you.
Nice
finally,
to meet
Gary.
you as well. Thanks, Andie.
Yeah, so I guess to start out, I want to know a little bit about a very simple topic called ACA compliance. I guess from your point of view as a healthcare expert, what are the biggest things that our employers are missing with Affordable Care Act compliance?
Oh, probably the two biggest areas, but one really big area, is properly understanding the measurement, administration, and stability period, and the way they're supposed to work. So think about it as breaking groups of employees out in different ways. The first are going to be they're full-time, they're always full-time, I'm not going to worry about it. Set them aside, and I don't have to worry about them until something changes in their employment. But for part-time and variable hour employees, the big issue is, what is that initial measurement period? What should my standard measurement period be? And then what happens during the stability period? Because that's where we see employers, all sizes, 50 and 5,000 employees, not necessarily getting it right. So I start with setting my standard measurement period, and yes, I can do it from anything from 3 months to 12 months. The most common by far is 12 months. Everybody gets that, no problem. But I'm finding lots of employers of all sizes setting it incorrectly as if they're on a calendar year plan, setting their measurement period to be calendar year. The problem is that leaves 0 days for administration to figure out who's in, who's out. I missed open enrollment, so whether I offered to the right people or not, I've totally missed. So we tell employers, think about, based on when your open enrollment is going to be, you can have any 12-month period of time. So if I'm a calendar year and my open enrollment is typically in November or even December for some smaller employers, have a measurement period of October 15th to October 14th. And use that as my standard measurement. It gives me time to sit down then and figure out who's over 30 or more, who's under 30 or more, and then expand from there and do your open enrollment correctly, making the offer. The second big area happens during the stability period. So, it's squirrely.
It's an endless topic.
Well, this morning I did the session, and probably of the hour and 15 minutes, we probably spent half an hour just on this area, which is crazy. It should be pretty straightforward. But what happens when one of my full-time employees, either that have always been full-time for years and years, or one of my employees gets reassigned and now goes from over 30 to under 30? Well, with one exception, where I can, as long as they cross a number of hurdles, in this very narrow exception, if that employee was full-time during the measurement period, they are going to be considered full-time during the stability period. Meaning, even though they're part-time, and I don't offer part-timers benefits, for the stability period, they're still full-time. Unless I can move them to the monthly measurement period. This is so exciting. It's amazingly exciting stuff. I have to continue to treat them as if they're a full-time employee for the health plan. And depending upon when they changed, I may have to treat them as full-time for the next stability period, for the next year. It's counterintuitive, so I get why a lot of HR professionals may get confused. But it's a problem, and to do it right, they really have to think through how they're going to treat. I don't have to worry about the employee who terminates. But if I have an employee who was and is not eligible, or wasn't eligible and now becomes eligible, I have to treat them correctly. And that is a problem that employers of all sizes seem to still be facing.
So even though technically this is 8 years that they've had to think about this and prepare for this, it's still problematic.
It is. And this piece of it is about 5 years old. And the rules have been out. They're pretty clear. There's not a lot of, There's a couple of areas where it gets murky,
Yeah.
but it's not that bad. We at this point in time, we pretty much understand how this is supposed to work. But we're still seeing employers doing what is intuitive, but not in compliance with ACA.
All right. Well, gosh, it'll be interesting to see what other compliance issues comes up as more parts of the health plan are changing everything as well.
Correct. So as the political environment is changing, and Congress or IRS, DOL, or HHS rewrite some of the rules, employers are going to have to stay right on top to make sure they're still in compliance with whatever rule changes come down the pipe.
And then as you, I'm sure, are very well aware, one of the big government decisions recently is that the Supreme Court doesn't have to defend these key provisions of the ACA, and some, I'm sure that's much more nuanced than my understanding, but then a lot of people out there are worried about pre-existing conditions, even in employer-sponsored plans. So I guess, what's your take on that?
So to frame this, a number of state attorney generals, typically from red, I think they're all from red states, have filed a federal lawsuit in the Northern District of Texas challenging the constitutionality of various provisions of the ACA now that Congress last year eliminated the individual mandate starting in 2019. And their argument is that if the individual mandate is gone, there's no longer a tax, which is what the Supreme Court decided back in 2012, which the court said in a very split decision that the ACA was constitutional because it contained this tax. Well, this tax is now gone starting next year. And so their argument is, well, then there are numbers of provisions related to the individual mandate, including the pre-existing condition limitation, which was prohibited by the ACA. And so now you have a lot of employers scrambling. And I see this going in any number of ways. Well, and earlier this month, the Justice Department and Jeff Sessions said that the Solicitor General was not going to defend the ACA. This is an extraordinarily unusual event. The Justice Department, in 99.9% of cases, not always, but almost always, defends a law once it's passed and defends the constitutionality of that law. Very, very rarely. This is a highly unusual step for them to say, we're not going to oppose those state attorney generals in court, in federal court. And so now it'll be interesting to see how first at the district, this is going to go to the Supreme Court, but first at the district court in Texas, then at the Circuit Court of Appeals, the Court of Appeals, the Federal Court of Appeals, and then eventually at the Supreme Court. Is anybody going to be allowed to defend it? There are predominantly blue state attorney generals who want to now defend that in court. Still too early to know if they're going to be allowed to. If pre-existing condition limitation, the prohibition on pre-existing condition limitations goes away, large employers are going to have a choice to make for their self-funded plans. Do they reimpose them or not? My concern is with smaller employers who are fully insured. And are their carriers going to want to reimpose pre-existing condition limitations, and the employer is not going to have a choice? They're either going to have to find a new carrier, or if all carriers go back like the old days, pre-ACA, what is this going to do for employees who have pre-existing condition limitations? We thought that was gone for good, but we don't know now. So we're going to wait and see in a couple of years when it eventually works its way to the Supreme Court, what do they end up saying?
I'll be curious to see what these large and small employers do decide about pre-existing conditions. I know one of the numbers I saw in my research, according to the Kaiser Family Foundation 2017, was that 27% of adults 65 and younger have a pre-existing condition, so it would infect a lot of the employee population.
And in that study, I'm very familiar, a very good study by KFF, they are looking at major pre-existing condition limitations. If you remember in the old days, really silly, small things that you would not think of, but if you had ever gone and gotten treatment. And so I'm concerned that the number could be, 50, 60% of the pre-Medicare eligible adult population could have a pre-existing condition where an insurer could just say, I'm not going to include you, or if I include you, your premiums are going to go through the roof. That's a concern.
Yeah, so I guess moving forward, we'll see where this goes exactly, but definitely an issue we should all keep updated on. It impacts a lot of people and it'll impact a lot of employers.
No question.
Great, I guess, do you have any final healthcare related thoughts for our employer audience?
No, I would only encourage employers to make sure they're still in compliance with all of the ERISA and ACA requirements, and if they are, all life is good.
Fantastic. Thank you so much for your time, Gary. I really like talking to you.
It's my pleasure, Andie. Thank you.
Yeah. Thanks for listening to Workforce Live.